Hi there. Yeah, Dr. Navelkar again and come with a talk on a new condition. Basically, I'm trying to summarize the all the conditions which occur in the middle ear just to give you a quick overview. And each condition is dealt with in a different presentation later on. But here we go. So the nose, as you know, is triangular approximately. Then there is the ear. As we go in, there is this eardrum. The eardrum is circular and seen end on it would be like this. Then there are the chain of three bones, and this part of the ear and the nose are connected through a tube, and then there is the nerve to the ear. We know that through this tube air enters the ear, and therefore as the sound waves hit against the eardrum vibrates. This causes this vibration to go through this chain of three bones, and when the third bone in this chain vibrates against this nerve, it converts this mechanical energy to electrical currents, which are conveyed to the brain, where it is decoded and perceived as sound. So much for the normal anatomy of the ear. Now, what goes wrong? We are considering mainly four middle ear conditions. One, the eardrum can get ruptured or perforated. So that is a perforation or a hole in the eardrum. Two, when the the bones behind the eardrum start getting damaged, and that is what is called a cholesteatoma. Quite a tongue twister, and it really twists the structure of the ear also, causes a lot of damage in the ear. It is something akin to a tumor of the ear, but not really a cancer. How they differ, I'll tell you a little later. Then there is this third condition where the third bone of this chain, which is called the stapes, gets fixed. Condition called otosclerosis. This is a hereditary condition, though it is not compulsory that it manifests in every generation. And this is called otosclerosis. And then there is this fourth condition where the middle ear gets filled with fluid, which is called middle ear effusion, or also called serous otitis media. It is serous but not serious, because this is quite a mild middle ear condition. The first condition now, ear perforations. Now, easy to understand. The nose, what is difficult however to understand is the three dimensions. We have to understand that as we go into the ear is one dimension, and as we go behind the ear is the second dimension. So the eustachian tube, or the tube which connects the nose to the ear, is slightly oblique in both the dimensions. Anyway, so it is basically why perforations occur is because when the infection, most often from the nose, goes through the eustachian tube into the middle ear space, where the organisms will multiply and start damaging the ear structures, more so the eardrum, thin the eardrum and come out of it as a perforation. Okay, so that results in a hole in the eardrum. However, this is not the only route which is the cause of perforations. A more logical route is when you put buds or anything into the ear, it may go straight into the eardrum and damage and perforate the eardrum. It could also occur because of blasts or direct injuries to the ear. But that apart, the common cause is of course the infection going from the nose into the ear. A little more magnified view, it is this perforation which is caused, and again harping on the same condition once again, but more to orient you to the next condition which comes, and that is the cholesteatoma. So we are seeing this in the front back view, where you have the ear being infected by infection coming through the tube, thinning the eardrum and then going out as a perforation. How these perforations behave, we will see in an independent presentation. But generally, small perforations heal, large perforations may require surgery, intermediate perforation requires skill and management and behave like small perforations and heal. Now, the thing is that this middle ear infection again need not be limited to the ear. They also can go into the mastoid. Now we must realize that the mastoid is a space which is behind the middle ear space, so it will be seen in somewhere in this dimension. This is what we really need to know at the present moment. Going back next to the next condition, and that is cholesteatoma, the tongue twister which I mentioned. This is basically this is the area which I have represented in gray is actually the bone, just to emphasize the fact that these cholesteatomas is basically destruction destructive process of the middle ear structures which can expand. So a cholesteatoma is like a sac in which debris causes it to expand. So it behaves like a middle ear tumor, but it's not a cancer, because the very definition of cancer means that it is able to detach from mother tissue and spread into the rest of the body. This is not able to do that, but however it causes quite a great damage to the ear. Now, if it were only the ear which we were concerned about and loss of hearing, we would probably not really treat this condition as a unsafe or a serious ear disease. It is the proximity of important structures to this, especially the brain, which gives this condition a little more serious outlook. So when cholesteatomas are detected, essentially the only approach is operation. However, of course, the early stages of cholesteatomas, which are called retraction pockets, which have not really gone too deep, can be managed medically. So there is a ray of hope for those kind of patients. Now, again, to emphasize how a cholesteatoma is dangerous, we are shifting view to the front to back. So this would be the middle ear space, and this is a mastoid. The mastoid is a much larger cavity which is like two rooms. They are connected by a partition, by a small passage in between, and the cholesteatoma which starts here actually would grow and quite occupy the middle ear space and can get into the brain two ways, up here or behind. Both parts of the brain have different functions, and therefore manifestation of this kind of invasion of disease into the brain is different. It can manifest with giddiness, it can manifest with high fevers, um, other brain complications, but the good part of it is that they are very slow growing, and usually other symptoms like discharge or pain in the ear precede brain complications, but either way these need to be operated. The third condition we are now coming to is due to uh, due to the block of the eustachian tube. Yeah, middle ear effusion or serous otitis media. Like I said, it is not serious, it is serous, which means thin fluid like, and this is the eustachian tube which, if it malfunctions, will underventilate the middle ear. So if the eustachian tube were to be get blocked, then like a room getting blocked, you would sweat. Similarly, nature produces fluid in this middle ear space, and that is what is middle ear effusion is all about. I have explained in one of the previous presentations of how the eustachian tube is essentially closed. It is attached via muscles to the palate, and it is these muscles which are pulled when the palate moves, as in swallowing, and opens the eustachian tube and lets air go in. So blockage of the eustachian tube, like I said, would cause it to sweat inside, or a fluid is produced inside. Nature's intention being that this fluid has proteolytic enzymes which could kind of open the eustachian tube and often reverse this block, and therefore many times we get away with blocks which have occurred because of simple colds. So when the fluid accumulates behind the eardrum, obviously even if the eardrum vibrates, the vibration is not conducted as smoothly into the inner ear, and therefore hearing suffers. However, another aspect to this is when this fluid is left alone untreated, it can cause the bones to get damaged or worn out. Now this condition is very common in children and a very common cause of underperformance in school of children, because children have adenoids. Just like you heard of throat tonsils, there are adenoids in children, which are the nose tonsils, which are present up to the age of 5 or so, and they would cause this dysfunction of both these eustachian tube. Both the middle ears get full of fluid, and without you realizing that the child is hearing less, uh, the child goes through a great part of life with subnormal hearing and therefore inattentiveness in school. But that is not the only cause. Simple colds, if present for long, if you blow your nose too hard, may go through the tube and cause this eustachian tube to get blocked. Further on that condition a little later in the other presentations. The last is otosclerosis. Now, otosclerosis is a condition which fixes this stapes bone. Okay, So the stapes bone is the last in the chain of the bones which conduct sound from the middle ear into the inner ear. And if we were to simplify this, this is the stapes bone on the cochlea. And to make it even more simple, the stapes bone is like a kind of a cork on this cochlea, which is like a fluid filled pot. So when this cork moves, the fluid is set into motion, and this causes the mechanical energy to be converted into currents, and the cochlea would further let the currents conduct the currents into the brain, and that is how sound is perceived. But if you can imagine that there is any condition where the around this bone, if a sticky substance is deposited, this bone would not be able to move, and that is the cause of hearing loss. So apparently the eardrum looks okay, there is no pain, no discharge, no infection has got into the ear, yet the person starts losing his hearing. And this is you often seen in families, so it is a hereditary condition but not manifested in every person in the family. And the lucky part of it is, the good part of it is that it is presumed that this condition, or any person who has even inherited this gene, will manifest only if the measles virus gets into the middle ear. And now with measles vaccination being a norm for all newborn children, the incidence of disease is very, very low. But interesting condition, because this condition is totally repairable, and can give really excellent hearing results in people who suffer from this condition if they are operated upon. So going further on this, this is the stapes bone which is fixed, and this is the part of that cochlea. So what is done essentially in this condition is, the upper part of this stapes bone is removed, a hole is drilled in this plate, and a small piston is hooked on to the second bone, and that is what restores hearing. This is supposed to be one of the most delicate operations, but one of the most rewarding operations in ENT practice.